Welcome to Conversations here on NTA Network. My name is Nike. And as you know, Conversations, we have been celebrating womanhood for weeks now. And we'll still focus on that today. We're talking about a bit of women's health, and we have another expert in the house. But first, we'll do some introductions.
Hi, my name is Farida Haruna, and it's an amazing time to be here. It's amazing to be here.
Good to see you
So,
again,
yeah.
Farida. Sir?
Hello, viewers. My name is Dr. Christopher Otabo, an orthopedic surgeon.
All right, sir. Thank you for joining us here in the conversation room.
Thank you.
Well, I'm sure a few of you may have seen the promo for today's topic. We're going to be talking about autoimmune diseases. That's when your own body fights back on you or fights back at you. So we'll take a quick feature and we'll be right back in the conversations room. Stay with us. Wow, so just watching that feature, it struck a nerve for me. I don't know about you, Farida, because there are so many conditions just like that that are autoimmune diseases, and it seems like you can't really do much, but you need definitely medical intervention and, medical advice. It's not something you can do all on your own. Dr. Chris, so could you just start with the basics and tell us more about autoimmune diseases? I mean, it's self-explanatory in the feature, but
Yeah.
we'd like to hear from you.
Okay. Thank you for the opportunity. Normally the body has a defense mechanism, and that defense mechanism helps the body to identify foreign invaders and fight them off. So when you have bacteria come into the body, viruses, or other substances in the environment, the body, the body's defense mechanism is triggered, and there are specialized cells that helps to engulf those organisms or render them ineffective and throws them out somehow. Unfortunately, in autoimmune diseases, that mechanism, that defense mechanism, is turned against the body cells. So that mechanism begins to recognize some tissues in the body as though they are foreign, as though they are the enemy. And so the body defense system, the cells, they begins to fight a self-destructive war.
Right.
Yes, they begin to attack the joint tissues that is rheumatoid arthritis, sometimes the thyroid, as in case of Graves' disease or Hashimoto thyroiditis. These are big names, but don't worry, they are just specific terms.
Okay.
If it affects the kidneys, like in lupus, you can have lupus nephritis, even the muscles, different organ system can be affected. So autoimmune disease is not one disease, it's a combination of
So
many diseases
Yeah.
depending on the symptomatology and the organs that's affected.
Can someone have more than one autoimmune disease?
Yes, but the truth is that one is usually more than enough trouble. So if you have more than one, yeah, it's possible. Yes, but most of the time there's a particular pattern. So you have rheumatoid arthritis. It's a particular pattern. That disease entity has a lot of symptoms. Most of the joints in the body takes the hit, and all that. Then you have systemic lupus erythematosus, what we generally call the lupus. That is autoimmune disease that affects many organs: the skin, the lungs, the heart, and the kidneys. So you also, even psoriasis is a particular type of skin manifestation of autoimmune disease. So there are a number of them, quite a lot. So is there a possibility for a combination? Yes, some people do have them, but like
As
I
you
said,
said, one is
one is
enough,
big
but
enough
having
trouble.
two is terrible.
Yes.
And does diabetes fall under this category?
Yeah,
Autoimmune disease.
there's a particular type of diabetes, type 1 diabetes.
Okay.
There are two types of diabetes, type 1 and type 2. Type 1 is common in younger people, and it could be a result of the body cells attacking the the insulin producing cells in the pancreas. Yes, in that case, yes, type 1 diabetes, a lot of the time, is as a result of an autoimmune condition. Yes.
Okay. I know you mentioned rheumatoid arthritis, and back then when I was growing up, there was rheumatism and then there's arthritis. Is it that it's a more modern term to call it that?
Well, rheumatism is more of a colloquial language. It's not known to medicine.
Oh,
Yes, it's
okay.
just let's say a lay language for certain kind of pains in the body.
Yeah.
Yes, but rheumatoid arthritis is um, is a specific disease entity
Okay.
that has various diagnostic criteria.
Okay.
Yes, you have to see certain signs, and then most of the time it's a diagnosis of exclusion. But as it progresses, then it becomes more obvious when the signs and symptoms become more florid.
Okay.
Yes.
And is it from a certain age? Can
I was going to ask that.
yeah,
Yeah,
is it
in terms
something-
of age,
So that we
yes. Like I said, in terms of the sex predilection first, about 80% of patients are women.
know. Wow. Why?
Yes.
Sorry.
Yeah,
I
well,
would like to know why.
up until now, we there's no definite reason. So research is still going on, but
Wow.
it's thought that because of the hormones, women
Okay.
have a lot of hormones
When
that
she
gives
starts
them
to-
that look as a woman. So it's thought that the hormones are responsible. Some school of thought say maybe because of the disproportionate fat.
Yeah.
Women have more fat in their system than males.
Okay.
Yes, but nobody has been able to clinch the reason, the exact
Why?
reason why. These are just postulations. Then also, that we were talking about the the age.
Yeah.
Yes, so it's around the age of 40 that it mostly manifests. Just before or around the age of 40. Yes, and it's also commoner in bigger women. Yes, yes, and
Overweight people.
overweight people. Then people with family history of rheumatoid arthritis.
So it can be genetic.
Yes, but the genetic aspect of it is not as straightforward as, oh, you have this and therefore your child will have it.
Okay.
Yes, because there are a lot of members of the family that will not have it. So there's incomplete penetrance. In other words, I can have rheumatoid arthritis, I have 4 kids, maybe 1 or 2 would have it.
Wow.
But if there's a family history, the incidence is higher than in people who don't have family history.
Interesting. So the lady in the feature talked about needing, or if there's a possibility that she might need surgery. Can you tell us a little bit about that? Why would she need to have surgery?
Okay, so for rheumatoid arthritis, as the joint destruction continues, there could be secondary changes in the joint, like deformities. You see someone who had straight legs before, she's now having knock knee, what they call K legs, or bow leg.
Oh,
That can
it-
happen late
that
in
can
life?
happen?
Yes, it can.
From straight leg to K leg?
Yes, as a result of degenerative changes in the body, in the
Wow.
joint. So
never knew that.
that's then also the joint cartilages can be eaten up, and if that happens, it will now lead to osteoarthritis. So rheumatoid arthritis can lead to osteoarthritis, and
Right.
once the joint is damaged beyond repair, then the only option for that joint is to be replaced. So she will require a joint replacement operation, where that joint is taken out and an artificial joint is put in place.
Okay.
That will take care of the pain. It will remove any deformity.
That's like the hip replacements that
Yes,
we hear.
like the hip knee replacement.
But the people that usually have these things are quite. I mean, when I hear a hip replacement, I hear people over 70 needing those
No, but
kind of
also
things.
Yes,
I
I do knee replacement for. We have done for a 15 years old.
yeah,
before.
that's what I was going to
Yes,
say.
sickle cell, exactly.
Yeah.
Oh,
So
wow.
it's as occasion demand.
Yeah.
So in younger people, you have it in people with sickle cell, people
Yeah,
with
a
Pettis
lot.
disease, other forms of diseases that occur in childhood. In rheumatoid arthritis can start around the age of 35, 40. But the patient may not require knee replacement or hip replacement until around 50s or 60s.
Okay.
So it depends on the trajectory of the disease, depends on the the natural history and the pattern, because some are slow, others are more aggressive. So there's no hard and fast rule as in when this patient will require surgical intervention. Yes, some may never even require.
Okay.
Yes, so it depends on the severity of the disease.
Okay. You
Yes.
talked about genetics. So if I already know it's established in my family history, or my parents have a certain autoimmune disease, is there anything I can do early on to
Well,
prevent it manifesting?
it's just general measures like being regular on exercise, eating healthy diets, and avoiding bad harmful lifestyle like alcohol, cigarettes,
Okay.
because these ones, they can make it show up in time or make it worse. And then you also have to control your weight, because the bigger you are, the higher the chances that you are going to come down with florid features of the disease.
There was a time a woman was saying, if I sit underneath the AC for a long time, maybe it will affect me in the future. Because whenever you use cold and everything, it might affect your joints and everything. So I didn't understand why she was saying that. She was like, this will affect you when you're in your 40s or 50s. Stop, reduce the way you use the AC, use fan and everything. And I'm like, why?
Well, not necessarily. There are people who live in the temperate region,
Yeah.
and I mean temperature of minus something.
Yeah.
When we go on holidays abroad, sometimes we do 5 degrees, 2 degrees,
Yeah.
and there are people who live there naturally.
Naturally.
So, but the reason why cold is
Affect the
deleterious,
joints.
yes, is because it can amplify symptoms of a disease that is already there.
Okay.
Yes.
Okay.
Yes, it can make it
You can
worse.
trigger it, push it.
Yes, the cold, it leads to vasoconstrictions.
Yeah.
And when the blood vessel is constricted, so there's no free flow of blood to that area. And so once there's vasoconstriction and there's no enough blood flow at that time, it can lead to pain and
Yeah.
stiffness and all that. But that should be momentary. Yes. But in terms of use of AC, just do what works for you.
Yeah.
There are people that they can stay in the AC for hours on end and they are fine. And some
there are people
within
that-
minutes
yeah,
they
joints.
have to make adjustments.
Yeah.
So just do what works for you.
It's like a lifestyle. Just
Yes.
do the lifestyle that works for you.
Yeah, do what
in
works for you.
general.
Yes.
Yeah.
Doctor, could you throw some light on multiple sclerosis? I hear about it a lot when I watch movies, medical dramas, but I don't seem to see many people talk about it here.
Yeah. The reason is because it's not a common disease in this environment.
Okay.
It's commoner in the West.
Right.
And it just like people hardly talk about malaria in the US or
Yes,
in
yes.
Europe.
Yeah.
Because if you have a case of malaria in Europe, they will call a conference. The doctors all will gather together and interrogate.
serious?
Yes, sometimes they may have to send your blood sample
I heard
somewhere
malaria
to do a
killed
test.
a woman in the UK, and I'm like,
Yes, because
Wow.
because it's not common, so it's strange. So the same thing, multiple sclerosis is an autoimmune disease. What happens is that the body defense cells, like I explained before,
yeah,
will begin to attack certain organs in the body. It's called multiple. Multiple is self-explanatory. Sclerosis is thickening. When you say something is sclerosed in the body, it means that part of the body has become thick.
yeah,
So multiple sclerosis, you have thickening of the skin, you have thickening of the heart muscles, you have thickening of the lungs, you have thickenings of the skeletal muscles. Everywhere is just hardening up. The individual is freezing up, and so because of that, our skin is supposed to be pliable, but it becomes thick like that of like you have momo,
So they say leather. but
yes,
for
or
most-
leather.
Yeah.
Yes. So
Right.
so it's going to be a problem. Even walking will be a problem, and the problem with multiple sclerosis is that it's progressive. Yes. So it will get to a time when the organs will begin to fail, because what manifests outside in form of thickening of the skin also manifest inside too. So the organs begins to fail, and eventually it might lead to end of life.
Please, what are the early symptoms? Because what you're saying is really scary, and we and the viewers at home need to know what we should look out for. Even the smallest.
First of all, it is very, very rare,
Okay.
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 extremely rare. So, especially in Nigeria,
Okay.
Okay.
you can't, you just don't think there. If there's going to be a diagnosis of multiple sclerosis, it's the doctor that will discover it, and it's a diagnosis of exclusion. So it's not what you come by. Maybe in the whole city you may not have more than 5 people having it.
Okay.
So don't let your mind go there, because you simply have something on your skin. This thing is generalized.
Okay.
Yes, and you just feel unwell, and you just know that something is happening and your life is probably ebbing away.
Wow.
Yes, but even at first, when they come to the hospitals, doctors' minds will not even go there. So it's as the disease progresses, then more florid signs will be showing up, and that's the same thing with most cases of autoimmune disease. They are hardly ever diagnosed at first.
Yeah, I was going to say, how do you
Yes.
even take test and how do you
Yes,
diagnose
sometimes it takes years before it will click that, oh, what we are dealing with here is an autoimmune
So it
disease.
keeps building up in the body till
Yes.
whenever it decides to show.
Yes,
its face.
yes, it keeps, the changes are slow, gradual, but very steady.
Okay.
Yes, it keep manifesting. Sometimes it just presents as general body pain, then it now localizes to the joint. Then there will be weakness, early morning stiffness, depending on the type of autoimmune disease. Yes, fatigue, and so on. And for those that affect the internal organs, the heart will be failing. You can't climb stairs. When you climb stairs, you are panting.
Wow.
Little exercise is causing you stress. And then those who have kidney manifestation will begin to, their kidney function tests begin to become deranged. And maybe the kidney urine output is getting less. So those are the things that then sometimes some people have shortage of blood. There's anemia. You do your complete blood count, discover that it's lower than expected for that person.
Wow.
Even though the person did not lose blood, no accident,
Nothing.
and is eating. So those are some of the things that makes you to become suspicious.
Okay. Doctor, is there any relationship between wearing high heels and arthritis? Because the lady in the feature story talked about heels. So I don't know if should we wear heels,
No.
shouldn't we? That's a
There's
Yeah,
really-
our mothers listening to us now will be like, yes, don't
Yes,
wear heels.
don't wear heels.
But you and I
No,
would
there's
still want to
no-
wear heels.
Still
for-
want to wear heels.
Even if there was, many ladies would not stop wearing
I
heels.
know. I'm looking. When she spoke about heels, I had to look at my leg. I'm like,
No,
I need to stop.
there's really not an issue with heels.
Okay, what about pregnant women in heels?
Pregnant women. in
It's
heels?
just not
Yes.
safe, because
not
the
safe.
tendency to fall is higher.
So
And
even
yes,
tilt your-
yes, you can twist your
twist
ankle.
your ankle.
Good.
Yes,
Yeah.
falling is more. People are more pro. So it's advisable for pregnant women to go on flat shoes.
Okay.
Okay.
Yes.
What are the common autoimmune diseases that you see regularly, like
In this environment.
in the environment, this environment?
Okay, so rheumatoid arthritis is the commonest
Okay.
that we see in this environment. Then systemic lupus erythematosus is increasing now. Is increasing.
Sorry,
you break
please, why is
that
it
down?
increasing?
Lupus, systemic lupus.
Lupus. Okay.
Erythematosus is just the redness.
Okay.
You find some people, they have this
Okay.
malar patch, like butterfly rash here.
Okay.
It's one of the telltale signs of systemic
Wow.
lupus.
Thank you very much.
Yes, it's not. I mean, you don't just see it on a lady that is enjoying her life, and you say when the person is sick,
Yeah.
and then you now
I've
see.
seen it once.
Yes,
Yeah.
you
I've
see
seen
it.
it once.
Yes, that's a diagnostic feature of systemic lupus.
Right.
Yes, so systemic lupus, rheumatoid arthritis, Graves' disease is an autoimmune disease
Okay.
where the antibodies are now that the body produces, the soldiers
Yeah.
is attacking the thyroid gland,
Wow.
and it causes it to produce more thyroxine. So you find some people, their eyes are their eyes are bulging,
Yeah.
and the white, normally the white part of the eye does not go beyond the margin of the black.
Yes.
But this one, you just see the black at the middle. Every other place white
It's
is
white.
is exposed.
Wow.
So that's Graves' disease,
Right.
and sometimes they have swelling in the neck.
Okay.
So that's a diagnostic sign. You can know that, okay, this person has
Graves' disease.
Graves' disease. Then even on the other extreme, Hashimoto's thyroiditis
Yeah.
is a type of thyroid problem, autoimmune disease, where the cells that produce the thyroid hormone are being attacked. So you have very low thyroid hormone production. The person is slow, is had so much weight, and extremely cold intolerant.
As you even said, one disorder is enough, because you said a lot. Just imagine somebody
Exactly,
having
more than one of these.
more than one,
Yes.
a lot.
Yes. Then
That's-
of course the type 1 diabetes is also a type of autoimmune disease.
I like
Yes.
the fact that you focused on lupus, because that has been, in social media a lot because of the Nollywood actress Kemi
Yes,
Afolabi,
yeah.
who's brought quite a bit of awareness to it. Is it truly possible for a doctor to give a timeline, a benchmark in terms of years on how long someone will
can
live
live.
based on these conditions?
Based on the person's
Yes,
condition.
because someone will tell you have 8 years to live, and you're like, no, I reject it.
Well, to reject it is, first of all, to put your faith to work, and
Yeah.
secondly, to also get the best care. But even in the best care, medically speaking, to a large extent, we can, in certain cases. I'll give you an example. 2020 March,
Yes.
someone came to me who had a breast cancer, very close person. So the cancer had spread a little, and so a close person to the family, a kind of family member, asked me, "Doctor, what's the hope?" I said, medically speaking, this lady probably has 2 years to live, and the lady died March this year, exactly 2 years.
Wow.
Yeah, that was a little bit too specific, maybe, but many times you can give a time frame and say plus
And the
or
person
minus.
surpasses it.
Yes,
Really
they can
hard.
surpass,
Yeah.
or it may not get there.
It
but
might not even
The
get there.
Africanness in us, is it something that you do? Is it something that people don't want to hear that?
People don't
Or
want
is
to hear that.
Is it something that you have to, as
It's
your training?
cultural. It's cultural. People don't want to hear that, and sometimes, most times I don't do that as a doctor, except it
Person.
coming from the patient or their close relatives.
Okay.
And I'm not going to tell you this. I will tell you, well, given XYZ that I can see, most people that have reached this stage, this is how long that is left.
Right.
So it's helped people to put their house together. Yes, if there are quarrels, you want to settle them.
If they
If
are-
you are
I thought you were
not, if you are
talking
not
about
right,
will.
if you are not right with God,
Quarrels.
you want to
Yes,
put
you
yourself
have
right
to,
with God.
yeah.
And then if you have a will that yes, you want to,
Yes.
like for instance, if someone comes in with metastatic cancer of the prostate that has spread to the spine, and you have done the first stage of treatment, which is hormonal treatment, and is recurring, then the person should start packing his bags. It's not, you don't have too much time left.
Wow.
So those things we do it, but for that of the lupus, well, I don't know. I've not seen the patient. I don't know what the information available to the doctor is, because the fact that someone has lupus does not mean that he doesn't have other diseases. Someone can have SLE and have HIV at the same time. So they both complicate each other. Someone can have lupus, and the doctor has seen that the kidney function test shows that 80% of the kidney is gone. So that is also a diagnostic, is a prognostic criteria. So I can't comment on that because I've not seen the patient.
Yeah.
But it's possible to hazard a guess as to how many years one might have remaining based on certain medical condition.
I have a message saying, wow, this program is a wonderful one. I'm enjoying it and it really helps because, there are people watching and probably have relatives who are like, oh, this kind of sounds familiar.
Yeah.
So, doctor, for instance, if someone wakes up and has a tingling in their hands and feet, is that a bad sign? I'm not talking about pins and needles, that's different, but that tingling.
Tingling, there are many possible causes of that, and it also depends on whether it's transient or whether it has come to stay. Yes, sometimes we feel some strange signs in the body and it just passes away almost immediately and then you move on. But if it's persistent, then we begin to ask some probing questions. First, you want to know if the patient is diabetic because that tingling is showing that the nerves are complaining. Okay, so diabetes can cause nerve complications. We call it neuropathy. So there'll be tingling. Some people will feel as though there's pepper on their hands and feet, and so on. So then also nerve compression from the neck can cause numbness and tingling in the hands and feet.
Okay.
So there are many possible causes. If it doesn't go away 1 day, 2 days, then it's better to go to the hospital for a check to know what is going on.
Well, speaking of opinion on getting medical checks, which is very important. People say, oh, you should get it done, but some people actually don't. I know you had a question for the doctor.
Yes, doctor, I have a question. I heard that, I have noticed or seen people, when they tell them they have arthritis or something, they'll prefer to go to a herbal doctor that would draw bad blood or dirty blood or do something for them instead of going to a doctor. And in the Northern Society, where we have lesser educated people most of the time, they'll rather go to a native doctor or somebody that can pull horn at the back and just do something for them and make them feel better. But they don't even get better, but they still go back and go back and go back. So what can you say about that?
Well, I'm happy that the answer to the question that you asked is actually in the question.
Yes.
Because you said that they don't get better. Medicine, there is psychology in medicine, but at the end of the day, the facts will speak for themselves. Those who are sick, there's only an extent to which they can deceive themselves. So my experience is that after all the rigmaroling around the traditional folks that are said to be drawing bad blood and all that, they still end up in my clinic and in some instances on my operation table, where we'll have to do the needful. I don't criticize. I'm not against traditional medical practice, but even in the traditional medical practice, there are also bad practices within it, and that we must kick against so that people can be safe. This issue of drawing bad blood from the knee in order to get relief, it's complete nonsense. It doesn't work. What happens is a distractive therapy. When you cut around, you create some scarification around the knee. It causes pain naturally. So that pain will temporarily mask the original pain that's in the knee. But at the end of the day, when the new pain is gone, you are back to square one. They're always doing it. They're always moving from place to place.
Yeah.
So that means that it doesn't work. Then tying the horn around the body that's like witchcraft. And it's not provable. So we only talk based on facts. We work based on something that has been proven or that can be proven. Yes.
Doctor, you have a question here. I love this program. My sister has an autoimmune disease, hardening of the skin and white patches on her body. All her hairs are gone for more than 20 years. Please, how do I help her?
Wow, she has psoriasis. That is an autoimmune disease. Yes, where there's thickening of the skin and a loss of coloration, white patches. I want to believe that for her to be alive for 20 years, it means that there must be some level of care that she has received. I don't know this current state of her sister, but um, the sister should continue to do what she's doing because it's working, and just see a rheumatologist. A rheumatologist is an expert. His specialty is in autoimmune diseases. Yes, though there are very few in the country, and that's the reason why many of us orthopedic surgeons have tried to bridge the gap to because there's a big portion of uh, rheumatology in orthopedic specialty. So we can't advise her from here because even if I have 1 hour, it's not enough. So she should go see a doctor, an orthopedic surgeon, or a rheumatologist who would, or a dermatologist. Yes, usually autoimmune disease is actually a multi-specialty treatment. Many specialists come together to help patients.
There's another one that sticks out to me. It says, I'm having numbness in the left part of my body, and most times I have headache also in the left part. I don't know if that has anything, but what are your first thoughts on that when you hear?
When you say left part of the body, we also want to know, is it the entire left half or left arm or left leg? Because the body is segmented and the brain has its role, then the nerves also have their role. So if one is having numbness on the left upper limb, then we are probably talking of a nerve compression. If it's in the left lower limb, we are talking of a nerve compression from the waist. So, but just the whole half of the body, except we are talking about something like a mini stroke or something, but we don't know how long. So it needs to go to the hospital so that we can check.
Okay. There's a lady here that says she was a nursing mother. The baby is 4 years old now, but the flow has refused to dry.
The breast milk?
Yes.
Okay.
And that she also has pain. Is that a sign of an autoimmune disease?
No, that's not a sign of autoimmune disease.
If it's still flowing?
No, it's not a sign. So it depends. If the baby is still suckling, then the breast milk will continue to flow.
He's 4 years old.
Yeah, no, some
4 years old,
people
right?
suckle till much later.
Yeah, but not Africans. I think
Yeah.
Africans might.
You try to.
You see, as long because the
yeah.
process of breast milk is a vicious cycle. Okay, when the baby suckle, it stimulates the brain to produce more breast milk, and it continues like that. Some people are in school and they are still suckling. So if the baby is still suckling, get the baby off the breast, then that can stop it. But if you have done that for some time and the breast milk is still coming out, then we have to now start looking at the hormones. Because there's a part of the brain that produces the hormones. If that part of the brain has a tumor, it can continue to produce hormones even when there's no stimulus from the breast.
Yeah, they say Google is your friend, right?
Yes.
And
I'm sure doctor will differ. Is Google really our friend?
is Google really our friend? Because if I have any symptoms, I Google just to know what. And also, before you answer that, since Google is, I don't know whether he's our friend or he's not our friend, but whenever maybe you have numbness or fatigue or pains in the joints, when I Google, they'll give you like home remedies, something to do. So, is Google really our friend?
Yes, Google is our friend and at the same time can be our enemy. So we have to use wisdom in all these things. There are a lot of patients that come to me with a mindset. Because they've Googled so many things.
Yeah.
So when I receive patients, I want to know what they know first. Yes, and it's not like we are not in a competition. Because if Google could treat you, I'm sure you would not even show up. So I want to know what you know. Yes, and then because you know what Google is. If you write nonsense now and post it,
It will find
someone
answer.
can Google you in US and start reading the nonsense.
Yes.
So so it's not controlled. It's anybody's thought that is putting. Some people Google will tell you if you want to lose weight, drink early morning urine. Rubbish. So there are a lot of nonsense out there.
Yeah.
But there are some that make sense. And then even when something makes sense, you may not really know how to apply it to yourself. So I want to hear from my patients, what do you know? Then the ones that are correct, I will agree with the patient. The one that is wrong, I would explain to the extent to which it is wrong and see what we can do to properly situate them with respect to what problem that they have. Because my role is to help you. And you are the one that is sick. Irrespective of the information you have already received. But if you still came to see me, that means you still need my help.
Definitely.
Yeah, so it's not a quarrel. It's setting things right.
Okay.
Yeah, so if you have pains,
Home
there are some home
remedies.
remedies, yes, like cold compress, warm, compress.
Okay.
Those are traditional practices that have helped in the past.
Okay.
Yes, so we may just now take it one step further.
To see
I
a
like the
doctor.
fact
Yes.
that we're talking about home remedies now, because we have a
Okay.
question that says, I was told that drinking warm water with lemon or apple cider vinegar first thing in the morning can keep me away from diseases. Doctor, your thoughts?
Yes, warm water with lemon has a lot of usefulness.
Okay.
Yes, and even the lemon flavor in water helps us to drink adequate quantity of water. That's if for nothing. That's one
Really?
of the useful.
Wow.
Yes,
It makes you
because
drink more.
yes, it makes you want to drink, because drinking adequate water is one of the good health practices.
That's very interesting.
Yes.
Okay.
Yes. So lemon water has its own benefits. Yes,
Okay.
I agree with that.
Okay, awesome. I feel pains when I pass out urine for over 5 years now. I have done everything medically possible. What do you think I should do next?
Okay, we also need to check his habit of urination, because if you hold urine for too long, when you are going to the loo, you will definitely have some pain, because the sphincters are inflamed now, the valve that helps to close the bladder from stop urine from coming out.
Yeah.
So it's I took note of the fact that the writer said that he has done everything medically possible.
Possible, yes.
That means that they probably have ruled out infection and some other things that I would have wanted to mention. So maybe he needs to see a urologist. That's the expert in water works in the body.
Okay.
So
Water works.
yes, to
Yes.
see what is missing. There may just be one thing that is missing, but in some circumstances, no matter what you do, it is what it is, and you have to live with it. Yes.
You had a question on a kneecap replacement. I think I've lost it along the line. Okay, so it says, please, I broke my. Good morning, sir and Maz. Please, I broke my left knee and can no longer bend it backwards. What can I do for over 20 years now?
Oh.
Wow, what a life!
That is-
20 years.
It didn't heal properly.
Yes,
That way.
that's one of the problems we have with traditional bone setters treatment. If you have a fracture, even if you didn't go anywhere and you can just hold the legs together and stay at home, the fracture will unite.
Okay.
Yes, the fracture will heal. That's what people don't know. A lot of people think, oh, the traditional bone setters are doing something special. No. If I break my bone and I'm able to keep it in one place and hold it in one place long enough, most of the time it will unite.
Okay.
But the question is, when you visit these people, in what way would it unite? Sometimes the bone has united, but her doctor say, I can't do like this. That's one of the complications, and that's where we come in. So we want to make sure that when you have a fracture, we give it the best chance to heal and with the least possible complications. Many times when you have a fracture around the knee, though it's on the bone, but if it is close to the knee and it extends into the knee joint, that's a big trouble in the future. It might unite, the bone might heal, but it will lead to stuff like this. You can't bend the knee, or later on you have arthritis within 1-2 years, because the integrity of the knee joint has been breached. The knee and the ankle joint, they are very unforgiving joints. You mess with them, you are going to have a problem for a long time.
The knee and the ankle joint.
Yes, so if there's a fracture around there, please don't go to traditional bone setters. Your fracture might heal by whatever maneuver, but you are going to be punished severely by the complications that will result from it. So for that guy, I don't know what has gone wrong. We need to see the x-ray, and after the x-ray and the examination of the patient, we will advise accordingly.
Okay. Good morning, doctor. I've been battling with rheumatism for some years now. It moves to different parts of my body and gives me swellings. Recently, I got severe pains on my bones and left shoulder and peppering feeling on my right leg. So what should I do?
Well, I don't know. She said she has had it for
She
years
said
now.
it's moving.
Yes.
But it moves to different
We
parts
call
of the
it
body.
fleeting joint pain. It's part
Fleeting?
of, yes,
Right.
fleeting joint pains. It just move from one joint to the other.
Wow.
It happens like that, especially the juvenile rheumatoid arthritis, the ones that happens in the younger people. Yes. So this is what we are discussing today. So
Yeah.
it's not as easy as saying go and take paracetamol. It's you need a doctor to evaluate you. There are different treatment modalities depending on the stage. There are medication, there are non-medication treatment. For the medication treatment, there are different types. There's disease modifying medication, there's non-steroidal anti-inflammatory, there are steroids. So it depends on where you are. Your doctor will give you the type of medication that you need. So rheumatoid arthritis requires some specialist intervention.
Okay.
Yes.
Do you have a question for him? I was
Yeah.
going to ask about
Okay, you can
bone
ask.
density because you mentioned women, and I know that's a challenge. Sometimes you watch some of these commercials and you see calcium supplements for women, particularly because of osteoporosis. So can you tell us at which point does our bone density start to reduce,
Okay.
wane?
So whatever you need to do to strengthen your bone, you have to do it before the age of 30. Because the graph is like
That's
this.
not an encouraging thing to tell me right now. That ship has sailed.
The graph is like this. The maximum bone density peaks at 30.
Okay.
Anything from 30 begins to go down. Then for women, when they hit menopause, there's a sharper decline.
Wow.
Yes, and that's why you have insufficiency fracture in women who are menopausal and above. They just have a little fall and then they have a fracture around the wrist,
Yes.
hip fractures, and then pain. I saw a patient yesterday who had severe pain in the body. I did the x-ray, the vertebra, the backbone is like biscuit, soft
Wow.
now. Yeah, so that can lead to fall. So in postmenopausal women, we have a challenge because some women, just out of their own constituency, are not able to go through that menopause period without turbulence. And so after the menopause, their bone strength drastically reduces. So it leads to, that's what we call osteoporosis, when the bone density is so low. And that has its own complications.
Yeah.
So it can lead to easy fracture, body pain, and so on and so
How do we
forth.
stop it? How do we?
Yes, so the cheapest way out is hormone replacement therapy,
Okay.
which is estrogen, because the difference between premenopausal and postmenopausal women is estrogen.
Okay.
At menopause, the ovaries dry up; they don't produce estrogen. The reason Farida is looking as beautiful as she is because of the estrogen that she has. Yes.
But are there foods with estrogen? It's
No,
not like-
it's produced in the body.
Okay.
So when women get to menopause and the menopausal signs are really terrible, many people can't cope, then there's what we call estrogen replacement therapy. You give it to them in form of injection under the skin.
Wow.
Yes, so that just brings back the freshness and takes away the pain, but it has side effects.
Okay.
Yes, some people it's prone to breast cancer.
Wow.
Yes, but
Thank God
no,
you
it's
said
not
side effects, because
it's
I know
not
a lot of
like-
people want to
Said
go
we
and
need
do
it now.
it.
You're
Yeah.
saying we need it.
Yes,
but if you
because
take
I did my project in my medical school. It was on breast cancer I worked on, and it's been found that there's a slight increase in the number of women coming down with breast cancer for those who use hormone replacement therapy as a treatment for.
Okay. Thank you, doctor, for all the help and advice. I've learned so many things, especially
Yeah, I
on
have.
autoimmune diseases. A lot of things I knew about lupus and all the others, but not in this Not the way the doctor has to shed light on
Detailed
it. Yeah,
way.
not as detailed. Thank you, Dr. Chris. Thank you, Farida,
Thank
also
you
for
so
joining
much for having
us
me. Thank
in
you
the
so much.
Conversations Room. Thank you to all our viewers that have joined us today in the Conversations Room. We'll see you again some other time. Goodbye.